Good afternoon. Welcome to this committee meeting of the Health and Welfare Committee. Today is October 18, 2021. It is now 12:30 in the House chamber, and I call this meeting to order. My name is Tina Sablon. I am the chair of this committee. We have present in the chamber today members Representative Sheila Babalta and BJ Attow. Representatives Donald Maglonia and Leila Staffler are excused for today. We do have a quorum. And I'd like to also introduce the staff that are assisting this committee today. We have our House Counsel, Joe Tyron, our Legislative Assistant, Claire Sablon, and John Diaz is providing assistance with our IT. And TG Rabago, if you could please join us as our fiscal analyst in case we have any questions that may come up. And with that, could I get a motion to adopt the agenda? The motion has been made and seconded. All in favor of adopting the agenda, please say aye. All opposed, please say nay. Motion carries. The agenda is now adopted. And our next order of business is public comments. And we do have Ms. Helen Sablon and Ms. Annie Regis from the CNMI Medicaid Agency. Welcome. Thank you for being here. You now have the floor.
Thank you. Good afternoon, Chair Sablon and members of the Health and Welfare Committee. My name is Helen Sablon, Director of the Commonwealth Medicaid Agency. Thank you for the opportunity to be here to provide my support and comments on House Bill 22-53. The Commonwealth Medicaid Agency strongly supports the passage of House Bill 22-53 to hire the Medicaid enterprise system and compliance personnel as required to meet the federal mandates of Title 19, U.S. Public Law 116-94, U.S. Public Law 114-225, and implements CNMI Public Law 21-28, which recognizes the need for MAS and compliance program and illustrates the policy level involvement and oversight to ensure that the CNMI will make reasonable and appropriate progress to improve the current eligibility and enrollment, and to implement a Medicaid management information systems claims processing with full capabilities to submit data to the transformed Medicaid statistical information system. Since October 1, 2020 to present, the CMA has only one personnel under the MES and compliance supporting the efforts of the program and project activities. The CMA has lost 12 months of time in hiring the personnel needed to move forward with the project activities. The CMA remains committed to effectively administer the Medicaid program despite the limited resources and major challenges the CMA confronts on a daily basis to improve the care of our U.S. citizens members. To illustrate the importance of the onboarding of MES personnel, a few weeks ago, the CMA encountered a cyber attack which crippled its operations. The CMA was unable to make eligibility determination for its Medicaid beneficiaries for a duration of 5 days. Unfortunately, the CMA's technical assistants and research partner employed 2 on-site IT personnel to assist CMA with its modernization initiatives. I would like Annie now to give you an update from for this project.
So we also would like to acknowledge our federal and state partners from the Office of the Governor, CNMI Office of IT, AG's Office, Homeland Security and Emergency Management, the FBI, and MS-ISAC for addressing and mitigating the issues that we had encountered for the cyber attack. It took a while to get us back to where we need to be, but we do appreciate all the efforts that have been provided by their offices to get us up and running. As Ms. Helen reiterated, addressed that the need for IT staff is much needed on site. We have not had any employee that is performing the information technology section. It's a huge need. Thankfully, the University of Hawaii, which is our technical assistance and research partner, had afforded to provide them on board under their office. So we are very hopeful that it passes. We are in much needed help and support to get this moving, the project moving, to be able to meet the federal mandates as required by Public Law 116-94. Thank you.
And we are also working with personnel in terms of hiring the appropriate staff for this project. So we're providing them with the job description, and we just received our grant award, so we're establishing that counts. But we want this to be to have this bill so that it's permanent, that we're not going to have these issues along the way.
Thank you, Ms. Sablon and Ms. Regis, for your comments and for those updates. So at this time, is Medicaid fully operational?
Yes,
Yes,
yes.
okay, that's
We
great.
had to close the office 1 week
Wow.
because there's no data. I mean, we don't have the eligibility and enrollment system. And so we can't even check, what's the status of an applicant if they come in to check their application or if they're going to apply. Everything is being done electronically. So.
Okay. And okay, and so you're working with OPM to announce these positions soon?
No, they've decided that they're going to do the accepted service contract.
Oh,
That's
okay.
great to hear.
Okay. All right. So they're
Ah.
moving ahead with accepted service contracts for MES,
Yes.
but you still need this to be in the legislation.
Yes, that is correct.
Okay, understood. At this time, colleagues, do you have any questions for our guests? Representative Eto.
Thank you, Madam Chair. Thank you to the Medicaid team for joining us this afternoon. Just wondering, with this new system, would it be readily available and accessible for patients that are sent to the various hospitals that accept Medicaid?
Not yet. We're still in the planning stage.
Okay.
So the
But-
system that was cyber attack was the eligibility and enrollment.
Oh, okay.
Yeah.
Okay. But with the system, if it's up and running in full capacity, we can have direct access electronically to the hospitals that serve our population for medical referral patients.
So that's actually on the infancy stages again. So we have multiple modules within our MMIS. So there's another submission that is going to come to light. There's a health information technology advanced planning document that we had submitted. They're moving towards a modernization, module. So the health information exchange and the personal health records would then be available at a later time. But that is one of the projects that we are working on in the future.
Okay.
Mhm.
All right. I just
That
bring
will
this up.
address,
Yeah, I bring this
yes.
up because this is one of the bigger challenges for our medical referral office, which is a
Coordination
bigger,
of
a more difficult challenge right now since it's directly under CHCC currently, right?
Right.
At the moment, and they don't have the flexibility of the reprogramming of funds to address the medical expenses off island. So I know that this is one of the things that's been brought up when we were there a couple weeks ago, that the hospitals and the various jurisdictions that accept our patients or the Medicaid patients, there's no access for them to be able to draw down the cost of medical treatment, and therefore the medical referral office shoulders that cost at I think it's $80,000 per resident or Medicaid referral patient outside of cinema, and rather than using the Medicaid funds, we're drawing down on the 80,000. But unfortunately, right now, medical referral is currently under CHCC, so we got to make sure we get that in line, and it's easier for them to transition. There.
Right. So is that you're asking about the coordination of care?
Well,
for
the
those type
the
of
program is
service?
gonna the program itself is gonna be upgraded, and it should be able to be accessible to the other jurisdictions, right? I understand all the privacy and all that stuff, but they
Mhm.
also have their own privacy standards, but at least accessibility so that treatment and care can be taken care of rather than worry about the financial payment obligations of the patients themselves.
Yes, that would have the ability to actually do so,
Cool.
as
All
far
right.
as coordination is concerned.
That's a
Yeah.
plan down the road. correct?
Yes.
Okay. Thank you.
And as long as, they send our patients to a Medicaid provider,
Absolutely.
yeah, that's the only way we can
Well,
pay for the services that the patient incurred.
yes.
Yeah.
Yes. Absolutely.
And with the system, the MMIS system, I would have that capability of the submission of claims electronically. So that will be, it'd be quicker for us to receive the claims to process. That's for this project that it's still in the planning.
And Medicare statistics are under your office as well?
No,
No? Okay.
No.
All right. Thank you. Thank you, Chair.
Thank you, Representative Attel. Any other questions? Okay, I do have one more question. Ms. Sablon, if you could just bring us up to speed on updates in Medicaid funding and the FMAP. I think last we met, we were all worried about the fiscal cliff. So where are we today?
we have just received our grant awards, and with the new system, the Muni system, it was like a chaos. So we finally we were told that we're gonna still continue the allotment form that we normally prepare. So it's being routed. And then we did receive 64 million for medical assistance payment for payment of medical claims. And also Annie is still, she got her grant awards also for the project from for the health information technology as well as the MMIS. So that's good to hear. Unfortunately, the funding or the matching FMAP requirement will still be the same up to December until such time that the U.S. Congress work on addressing that issue.
And by the same, you mean the 55-45?
Yes.
Okay.
But
Alright.
because of the continuing resolution, it's going to be up to December.
Okay.
So it's 83 plus a 6.2 from the CARES Act.
Mhm.
So it's 89.2 with a 10.8 local share.
Okay. And that local share should be covered in this fiscal year through the ARPA funds.
Yes.
Okay.
Yes.
All right. Thank you for that. And that's it for my questions. I think we can thank our guests. Thank you, Ms. Sablon. Thank you,
Thank
Ms.
you.
Regis. And if there are no further comments, you may be excused.
Thank you.
Thank you. So doesn't appear that there are any other comments from the public, so we can move on to our next item of business, colleagues. Review and action on the bills and committee reports, and we have just two bills up for action today. House Bill 2253, House Substitute 1, which was accepted by this committee at our last meeting, and the committee report, it has been prepared. I did ask our LA, Ms. Sablon, to update it to include the comments that we received today from Ms. Sablon, Ms. Helen Sablon. And I think that would those would be the only changes that were incorporated, along with, the fiscal analysis was also updated today to include comments received from the Medicaid agency. And Ms. Sablon, Mr. Ravago, are there any other changes that you'd like to make the members aware of for the committee report? Okay. Okay, so I think our first order of business for this part is to actually adopt and vote to pass the House substitute bill, and then direct the staff to finalize the committee report so that we can sign it and pre-file it with the clerk. So may I ask for that motion, please? Okay, the motion has been made and seconded. All in favor of adopting House Bill 2253, House Substitute 1, and recommending its passage, and finalizing and approving the committee report, please say aye. All opposed, please say nay. Okay, the motion carries, and House Bill 2253, House Substitute 1, is hereby approved for passage to the full House. Okay, And then next in our order of business is House Bill 2215 to establish the foster care sponsorship program within DCCA's Division of Youth Services. So the committee report that has been prepared recommends this bill's passage in its current form. Colleagues, do you have any comments on this bill at this time, or comments on the draft committee report that was circulated for your review?
Madam Chair, I don't have any comments. Just a question. And DYS had came up with their position, and they're in support of the legislation. But one of the comments that they provided was Behavioral Health Planning Council, chaired by Mr. Ty Dorham. Do we have anything from him?
Oh, to request comments from that council.
Yeah.
No, we don't have any comments from
okay.
Mr. Dorham.
Well, Mr. Dorham also had more than enough time, right, to
Mhm.
provide comments. This bill's been out, and
Yeah.
the committee has reviewed it a couple of times already. So I have no issues with the legislation with the committee report that's being presented to this body.
Yeah,
Thank you,
thank
Madam
you.
Chair.
And we could actually, since we're on that subject, I did get some queries about this bill from former foster parents who they were interested in like future opportunities to comment on the foster care program in general, right? And the need for, more operating guidelines, more financial support for families. So, I think that the conversation could continue. This is really more like enabling legislation that would empower DYS to expand, the full range of resources that they can solicit and raise for this program. But yeah, that brings up a good point, Representative Attal. I think that there will be some interest in the community in soliciting more comments on how this program can be strengthened even beyond this legislation. So thank you for that. Any other comments or questions at this time? Ready? Okay. May I ask for a motion to adopt this bill in its current form? Okay, motion has been made and seconded. All in favor of the motion to adopt House Bill 2215, please say aye. All opposed, please say nay. Okay, the motion carries, and the committee report is pretty much final. I think, colleagues, if you have a chance to sign it afterwards, and we can pre-file it with the clerk after today. Okay, and that is it for our order of business. And item D, are there any announcements? I do have an announcement. I will be going off island for family medical referral starting this week. But I have asked that we pre-file these bills and these committee reports so that we can act on them at the next session. So I will be counting on you to carry the torch, and if I'm not here by the time the session is called. Any other announcements? Okay. Miscellaneous updates on the medical referral program and House Bill 2277. So with the passage and the governor's signature on the Budget Act, the medical referral program and all the funds that have been allocated do now fall under the Commonwealth Healthcare Corporation. But my understanding is that transition process from the Office of the Governor to CHCC is still ongoing. And there are some concerns that have been raised, about the transition of the employees, especially the civil service employees who are with the medical referral office now. And then, a couple of other issues that have come up that we may want to consider inserting additional language to the current bill. So we could, if you are able to join us, colleagues, Mr. Sablon will be coming for a meeting this afternoon. And then I did set up a meeting with Ms. Esther Munia for tomorrow, for tomorrow. So I'll provide the details, and then I think maybe when I come back, we can revisit that legislation and any amendments that might make sense for the program. And that's it. Are there any questions? 1:30. Yeah. Okay. Any other items for miscellaneous? Okay. And our next item is adjournment. May I have a motion to adjourn, please? Motion has been made and seconded. All in favor of adjourning this meeting, please say aye. All opposed, please say nay. This meeting is now adjourned, and it is 12:51 p.m. Thank you, colleagues. Thank you, staff.